background is clinical, so I don't really get a lot of exposure to builders and architects. So I've been exposed to a lot of new information, particularly on how they work and some of their issues, as well as new tools that we can use to visualise building design and tools like the Green Star and the BIM, and that was really, really valuable. I work in a very old hospital, which is soon to be replaced with a new state-of-the-art hospital, and I'd heard that we were having paperless patient notes. I heard that we were getting robotics to deliver trolleys for linen and for meal trolleys, and I was able to actually visualise that by particularly the presentation from the UK, from the Forth Valley Hospital, and also looking at some of the other presentations where people were sharing their experiences. So that was invaluable for me, because I can now go back and share that information with other people. First of all, we're being reactive, we're not being proactive, although we've come an awful long way in the last 5 years. We have to provide bariatric patients with safe and dignified care, and many hospitals are not able to do that now. Part of that is an education process for staff on that these people are sick people, and not to discriminate against them. And partly, if we're working in an old hospital, we don't have the space, and that in turn is putting our staff at risk. Quite often we don't have the equipment that we need, or we're using equipment where we're relying on increased manual handling from staff, and we're putting them at greater risk of injury. So I'm learning that we need to engineer out a lot of those sort of problems, and particularly with new building design or renovations, we've got to make sure that we include things that are going to make the nurses' jobs less, give them less chance of having an injury, make them safer, but at the same time provide the patient with dignified and safe care. Probably because there aren't any. We seem to be learning as we go along, and that information needs to be shared. That is just for hospitals. Hospitals are doing a lot better than community, and they're doing a lot better than aged care. So we need a standard definition. We need to have a lot more information sharing and resources out there for all healthcare sectors.